Hello, everyone. Welcome to this Instagram live where I'll be in conversation with Dr. Anuj Chawla, and we'll be discussing surgery versus orthopedics as a career option, and we'll be talking about the institutes where you can do these courses from, and is orthopedics really a terminal or an end branch now, or does it also require specialization? Hi, good evening, everyone. Just if you're able to hear me, just give me a thumbs up. Dr. Anuj is just about to join, and we'll start.
Hi,
So,
hi,
Dr. Anuj is
hi,
here.
Rohan.
Welcome,
How are
sir.
you? Can
Good
you hear
evening.
me? Okay, great.
Yes, I can hear
Okay,
you, sir. Loud
yeah.
and clear. Okay. So, welcome, everyone. Welcome once again. I'll be in conversation with Dr. Anuj today. Dr. Anuj was my senior at Safdarjung, and he is the best foot and ankle surgeon in the country. And I can tell you from experience because he's the one who helps me manage my flat foot. So, welcome, sir,
Thank you very
welcome to
much,
this
Rohan, for
Instagram
such a
Live.
warm introduction of making me the best in the country. And definitely, I can tell you that, Rohan, this not just being a great academician, he is a great surgeon as well. I've had personally, seen him operate, not just on patients, but on my wife as well. So definitely hands down to him as well for, being such a humble person, a great surgeon, and a great academician and a teacher as well. So, yeah. Uh,
Right. Thank you, sir. So, just to give you a brief background, sir has done his MS from Safdarjung, MS in orthopedics, and he's done his MRCS as well. And he is a specialist foot and ankle surgeon. So that's what he's doing day in, day out. Like I am doing only breast surgery, sir is only doing foot and ankle surgery. So the background behind this Instagram live is that we were having a conversation in the doctor's lounge the other day, where Dr. Anuj said that orthopedics is no longer a terminal branch. One has to do specialization. So, sir, before we come to that question, both of us, after our exams, were getting surgery in orthopedics. And I had my reasons for taking up surgery, which I'll share in a moment. But you also were interested in surgery and orthopedics both. What were the reasons which made you take up
okay.
orthopedics over
Uh,
surgery?
well, yes, we always have the discussion about why I chose orthopedics versus an option of surgery. When I did my, there are multiple reasons for it. I think some of them I have not shared with Rohan as well. So I think the most important reason which was inculcated in me when I was doing my internship in MAMC, so I'm Maulana Azad Medical College product. So when I was doing my internship, there was one thing which was inculcated in me that orthopedics is an end branch. So you do MS orthopedics, you're done. You don't really have to do a super specialization. You've finished your studies as soon as you clear your MS exam. Um, and in contrast to surgery, in which once you do an MS of general surgery, then after that you have to do either DNB or MCH and basically super specialization because this is what you do. You would finally do either urology or gastrosurgery, neurosurgery. I mean, you can do anything. So that's basically you have to super specialized after that, which is not there in case of orthopedics. And I was very happy that I have secured finally I've secured a rank in which I can actually opt for an end branch, and I would stop giving exams after
Stop
that.
giving exams.
And I was so wrong in that. So that is one thing. The other thing, I think it is more of an attitude, personality, which again, my viewpoint was broken because I was in Maulana Azad. So I've always seen the surgeons as very serious kind of a person, and the postgraduates of surgery as being overworked and a little bit frustrated as well. I was not very satisfied with the way surgery residents were being groomed in my institution. So that was another reason. And when I went to ortho, so there's always this concept of tea break in NAMC, in which maybe around 12 o'clock you would just stop all the OPD, you sit around, you discuss, you have some chai pe charcha, and you discuss about the potential future cases that you're going to do in the next in the subsequent week, or just discuss about some difficult cases that have come in the OPD. During that period, I mean, that discussion was only for 10 minutes, but it was mainly about chit-chatting amongst each other. And I was in surgery, in the team I was there, the everyone was very frustrated. While when I came to orthopedics, it was Dr. Dhal, and he was a totally different personality. The discussion was about, about anything, about, traveling overseas, about cars, about, a lot of things which was non-academic and which were very interesting, and everyone was made to feel a part, were made a part, and I was also interacting in that. So I like the attitude of the orthopedic surgeons personally. So that was another thing, but I always said that I would not get that kind of a rank, and that is the reason that I was okay with surgery. Though surgically, I love surgery a lot. I could not understand orthopedics. But these were two main reasons. But main reason which was told is that orthopedics is a terminal branch. I am here to debunk that myth.
Fine. So, sir's reasons of taking up orthopedics were A, it was a terminal branch, which we are going to discuss, and which he said that is not partly true now. And B was the exposure and the attitude of the orthopedicians, the cool orthopedicians, not always Kabir Singh types,
Right.
but the cool attitude. So my reasons for taking up surgery, I was very clear that I didn't have a great experience during internship in orthopedics, and that was one reason. But I had probably made up my mind in second year MBBS only that I wanted to do general surgery, and even if I had a rank where I was getting radio ortho, it did not affect my decision any which way. So my request to all of you, if you've got a rank where you are getting more options, I know there is a problem of plenty, but whatever branch you were interested in before appearing for the exam, please don't let go of that branch. Listen to your heart and follow that branch, because you have to practice that for the next 40 years. And if you're not happy with it, you'll always keep on cribbing and you'll be frustrated. So, coming to the main question, sir, you said that orthopedics is no longer a terminal branch. Can you elaborate on that? And I have another follow-up question to that, if you can include that in your answer. Does your answer hold true if I'm talking about the person settling in a tier 1 city versus a tier 2, tier 3
Right. I
city?
think the second question is very important as well. I'm talking on behalf of being staying and practicing in tier one city. So what happens when you do orthopedics is that you've done MS orthopedics. Now, once you've done MS orthopedics, you can do some SR-ship and all. But what eventually happens is that you are practicing general orthopedic surgery. That means if a patient comes with neck pain, you would see that. If a patient comes with an ankle pain, you would see that. If a patient comes with hip pain or a knee arthritis, you would see that. You would do all kind of surgery, which is, I mean, if I divide it, it would be knee replacement surgeries, if you've heard all those things. You would be doing arthroscoping, you would be doing trauma surgeries. This is what the general concept is with regards to orthopedics is concerned, and that is why it is considered to be a terminal branch. But having said that, if you're staying in tier one city and as soon as you try to enter into a corporate hospital, I'm talking about private practice per se, uh, there would be a plenty of more senior guys than you. So that is number one. And now the concept is that the public, the patients are changing. The patients are also looking for a specialist. So even today, even if I'm doing as an OPD as an orthopedic surgeon, if I saw seven patients, of which five would be for foot and ankle related ailments, which would include a day one ankle sprain. The patient would come from 10 kilometers in Gurgaon when they have 50 orthopedic surgeons in between, but the patient is still coming to an orthopedic foot and ankle specialist. Uh, so that is the thing that now the patients are also looking for specialists because there are specialists available. You would have hundreds of doctors doing arthroplasty. You would have doctors doing arthroscopy, specializing in bodies related parts like shoulder specialists, knee specialists, ankle specialists, hand specialists, and spine specialists. The problem is that we do not have recognized courses at the moment, and this is the biggest problem. And still, there are lots and lots of people who are still doing both, doing everything, which means they are doing general orthopedics. Um, so there comes the problem because we do not have a recognized course, so we are reliant on fellowships. For fellowships, we generally go outside, which is again a big struggle. I mean, I would say I actually stayed overseas for almost 7 years, during which I was in Singapore, and I developed that interest in foot and ankle surgery. The fact is, I was not exposed to this at all during my 6 years of training in India. And because it was totally new for me, so I tried to learn it. And once I got interest, I, specialized in it, and then I did my fellowship. Uh, so that is where you have
Sure.
to come across. So this is about tier one cities. So then when we talk about tier two,
Hmm.
I think we are still at the level when, everyone is doing general orthopedics. So even if you do an MS orthopedics and you settle in a tier two or maybe a tier three city, you would, you would still be, doing really well. But I am going to Chandigarh, which is between tier one and tier two, and there also the department demand of foot and ankle surgery has increased significantly. So that concept is now changing, and maybe by the time the students who who clear their MS, then they did do SRship, it would be another 6 to 7 years. That concept is going to get inculcated in the tier two cities as well by that time.
So, what Dr. Anuja said, I'll just summarize that, sir. So, in tier one city, especially if you're working in a corporate hospital, patients are becoming more aware. So, they want to come to a super specialist, a foot and ankle, or a spine surgeon, or an arthroplasty surgeon, or somebody who's doing arthroscopies. So that is one reason why somebody needs to specialize. The second point which Dr. Anuj made is lack of courses, lack of recognized courses in India for these branches. So one has to go abroad for fellowships. Now, I would like to add here that this is how it started off in surgery as well. Like when I wanted to become a breast surgeon, there wasn't any MCH in breast surgery at that time. But now there is a dedicated MCH in breast surgery at AIMS and even Tata. So gradually, as more and more awareness comes, more courses will also come up for these individual branches. In tier three cities, currently a general orthopedician can also survive, but with time there will be more demand for specialists as well. Now, a counter question here is, and this is what students also ask me regarding surgery. Does that mean that a general orthopedic surgeon cannot survive in a tier one city or will not do well in a tier one
Well,
city?
I think for a general orthopedic surgeon, I think you can still survive. Okay, you might not make a big name, but you can survive reasonably well even. And there are lots and lots of my colleagues. I mean, frankly speaking, I know. I think in my batch in Maulana Azad, almost 8 doctors they did MS orthopedics. I am the only person who is specializing in one field. The rest are still doing everything, though they claim themselves to be arthroscopy surgeon or arthroplasty surgeon. They are literally doing almost everything, and of which, except for three, most of them are actually settled in tier one city, and three of them are actually doing private practice in big corporate hospitals in Delhi itself. So they are also surviving. But will you make an impact? The answer is probably no. So, and in future, it would be a problem.
Okay. So sir is saying that, right. So sir is saying it's not as if you cannot survive as a general orthopedic surgeon in a tier one city, but to make a big name or big impact is going to be slightly challenging. Not impossible, but challenging. When I come to surgery, so this is something which everyone asks me, that just after doing MS surgery, can one survive in a tier one city, tier two, tier three city? Of course, in tier two, tier three city, you can survive as a general surgeon and you can flourish as well if you have laparoscopy skills. Even in a tier one city, here I have seen a lot of general surgeons who are competent in laparoscopy. They are doing exceedingly well. Now, whether it is in corporates or whether it is by doing freelancing, they are still making a name for themselves. So here, surgery and orthopedics are slightly different as per Dr. Anuj's views. Now, sir, when I posted this topic, I was surprised to see that the maximum number of comments were from females. And they want to know that can they break the stereotype of girls not choosing not choosing orthopedics. So can girls choose orthopedics? And can you share with your experience in Singapore and in UK that were ladies
Yeah, of
practicing
course. I mean,
orthopedics there?
I still couldn't get the reason why girls do not choose orthopedics. I think when I was in Singapore, and as you mentioned, so the ratio was in Singapore, the ratio was still, I would say, 30 to 70% for orthopedics. But when we talk about hand surgery, which is another specialization in Singapore, it is not a part of orthopedics. So hand surgery, the ratio is around 60%, 50 to 60% of them are actually women. Uh, when I was in UK, yeah,
But the sorry to interrupt you, sir. So the progression to
no,
hand surgery goes
it is
via
a totally
orthopedics
different.
there.
It is a separate 6 years
It's a separate.
program in which
Okay.
you come to orthopedics for a short period. That's it. It's one or
So it's a combination of orthopedics
It
and
is
plastic surgery.
completely orthopedics. You have a rotatory posting in orthopedics for 6 months in 2 times, and also in plastic surgery, also for a short period. So
Okay.
this is
All right.
one thing, and the other, yeah, we're talking about UK. So UK also, I saw almost 40% of the orthopedic surgeons were female. And considering the fact that it is more specialty driven overseas, which is still not a concept in India. So the specialties in which the women are more interested overseas is hand surgery, which is a lot of fine skills, just like plastic surgeon. Same is with foot and ankle surgery. You see a lot of women in foot and ankle surgery. And then even in spine, which means scoliosis correction and arthroscopy. And I obviously mentioned about the hand surgery as well. So that is there, but something like trauma surgery was not so common. So I think it is just because it is only trauma surgery in which you have to be a bit more masculine and in which you might be, it might not be a good choice for a female. But if you're looking for a specialized practice, I think you will perform exceedingly well because women, I believe that their soft tissue handling skills are better than men, at least orthopods men.
So why do you think in India they are not
I
taking
think
up
it's just the same
orthopedics as a
stereotype like
branch?
men not picking up gynec in India. I have,
No, I guess in certain states there are a lot of
but
male gynecologists, but females are still apprehensive in taking up orthopedics. So, do you think it's also got to do with the training process, a male-dominated training process, and the way they're treated in an orthopedics ward?
you
I personally have seen when female interns go into the orthopedics ward, I've seen the reactions and what happens. So, do you think that's also
That
playing in
might
their mind?
be, in the minds of, I think, yes, both in the residents and, but yeah, maybe it's still, you can say, maybe a little bit still conservative society. But if you talk about, especially, I believe if women have to, go forward, then they are really mentally very strong if they decide to take orthopedics. And I have seen, for example, when you're talking about about orthopedic conferences, when I attended a conference, yeah, like 10 years back, versus when I see attend a conference now, I see a lot of women orthopedic surgeons now. Talking about Indian Orthopedic Association, not the North Zone one. North Zone one is still male dominated, but I personally have seen a lot of female orthopedic surgeons participating in Indian Orthopedic Association conference, which mainly are still in South. The number would still be, I would not say more than 10%.
But how are they doing? I mean, are they
There
performing
is there is
equally
no
well
reason
as
for
their male
there is no reason
counterparts,
for them
the
not to
Indian?
perform. There is no reason.
Great. Yeah. So, it coming to surgery. So, surgery for females, I mean, we are seeing more and more females taking up surgery. And if you're passionate about it, please do go for it. There is a detailed video where I've spoken to two female surgeons. It's there on my YouTube channel. It's a 20-minute video. And if you're a female who's interested in taking up surgery, I would strongly urge you to watch that video and it'll clarify a lot of misconceptions which you have regarding surgery as a career option for females. So the settling down time, if we talk about that in surgery versus orthopedics, a lot of people say that the time taken to settle down in surgery is much longer than orthopedics. What would be
Well, I
your views
personally do
regarding
not
that, sir?
think so. I mean, I have seen a lot of surgeons who finally did a specialization into one particular field. Of my age, a lot of them are very well placed in good corporate setups as well. Okay, orthopedics, I would not say that all of them are very well placed. Orthopedics, it is still, again, as I mentioned, like currently in orthopedics, I mean, the system is still that there would be one very senior guy. In general surgery, if you talk about, surgery, now considering the fact that it has compartmentalized, if you have specialization. So, like for example, I see Rohan doing exceptionally well in breast surgery, and he's one of the few breast surgeons, and the patients are coming looking for him. This is because the concept in the because the awareness in the patient's mind has increased as well. So that is why I feel that the competition is still not that stiff in specialized surgery, not in general surgery, but once you do a specialization. Orthopedics, the competition is still quite stiff because the concept is still about general orthopedics.
So would you imply, by saying that, you imply that there's a lot of saturation as well
In tier one
in
cities,
general
yes.
orthopedics in tier one cities? Fair enough. So, look, surgery versus orthopedics, I think so. In any surgical branch, you will require a few years more to settle down as compared to any medical branch. And even in a medical branch which has procedures involved, like cardiology, right? Or gastroenterology, there also the settling down time would be slightly more than a non-invasive branch like, say, endocrinology, where you can make a name for yourself. So if you are interested in a surgical branch, you should be ready to put in these 2-3 years extra, because you'll have to work under a mentor before you can establish a name for yourself. In surgery versus orthopedics, it is pretty much the same time, give or take 1 or 2 years. So that is my take on it. Again, this should not be a deterrent for you to take up a surgical branch, because I guess once you're 45, once you're 50, nobody is going to ask you this question, that at what age did you start practicing independently? Okay, because you'll be doing well for yourself. So work-life balance, I've got a lot of questions regarding work-life balance, saying that orthopedicians have to attend a lot of emergencies because of fractures. The work-life balance is not there. What are your views regarding work-life balance? And is it something which a doctor has to define for himself, or is it a
I personally do not think
branch-related
it is
thing?
branch-related thing. I mean, if you talk about general surgery, then you can have acute abdomens, and which I would say are more urgent, issues to deal with as compared to orthopedics, where most of the cases are more elective. Even fractures, I mean, if you are on call, then you will have to see it. But suppose if I am a consultant and there is one registrar who's on duty, I do not have to come for all the fractures. Okay, so at one point of time, you do not really have to come and do a lot of emergency services and emergency duties. With regard to work-life balance, I think this holds true with any medical profession. The work-life balance has to be set up by the doctor, and it has no relation with the specialty that you opt for.
Great. I completely agree with sir that as I've told you, that in any surgical branch, you will be slightly overworked more than a medical branch for a few years more. But after that, once you're starting your own practice, it is dependent on you how you want to strike a work-life balance, right? So if I for one don't like to do evening OPDs. Okay, so I have made a conscious effort that I will not do evening OPDs. If a patient wants to show to me, they can come the next day. Yes, I might lose one odd patient, but in the bigger scheme of things, if a patient really wants to come and see me, most of the time that I've seen that they come the next day and they show themselves to me. So a few questions related to residency, sir. So in surgical branches and in orthopedics, there's always a tussle whether to go for a central institute or a peripheral institute where there is more cutting. So what are the key points which one should look out for if they're choosing an orthopedics
Well, I have done
residency?
orthopedics residency from a central institute, so I can definitely relate that very well. When we talk about peripheral institutions as well, I mean, if you're talking about government hospitals, maybe you would do a lot of cutting, but the thing is, it is very unsupervised and your quality might not improve. So I think one big question that comes in that the residents ask me is, for example, AIMS. So AIMS orthopedics, the amount of cutting is very limited. You most of the time see things and you do not really operate a lot. But please understand the bigger picture that you are in for 3 years, you're at an institution which is doing the best clinical work as long as orthopedics is concerned. And you're exposed to everything. You're getting your concepts right. You're getting exposed to each and everything. This is the part of training. This does not define how you're going to perform as a surgeon. So yes, I at one point of time had when I was doing my postgraduate, I had a senior resident who had come fresh pass out from AIMS, and he was a first year senior resident in Safdarjung. And then I had obviously I had senior resident from Safdarjung as well. So those who were in Safdarjung, they were like a bit more experienced, a bit more confident of handling trauma surgeries. While in the first year, definitely the AIMS senior resident was not. But as the time picked up, because he has got the concepts right, he did exceptionally well. And eventually, if I rate him, he was eventually, when he came out after 3 years, he was a better surgeon than any other orthopedic surgeon. So in that sense, I don't think that you should localize yourself to going to a peripheral hospital deliberately so that you can do a bit more cutting. You should focus on getting the concept right and go for a better institution where there is better teaching and better learning.
I completely agree. So in the long run, of course, 1 year of more cutting or less cutting doesn't make a difference. And while when you're choosing an institute for any surgical branch, there are certain things which you should look out for. So number one is the overall exposure which you get. Okay, so that is also very important. And like Dr. Anuj mentioned, that the overall exposure in a central institute like AIMS is tremendous, where the wide variety of surgery which you see and the skilled surgeries which you see, that really opens up your mind as well. Now, in terms of cutting, yes, cutting opportunities are important, but you need to understand that there is a learning curve for all the surgeries, right? So if somebody is telling you that as a token, if one resident has done one mastectomy during their residency, that doesn't make them proficient in doing mastectomy, right? So all these token surgeries, they will only come with your rapport building. But what is important is that that institute should give you the basic surgeries in adequate number. So if I talk about surgery like appendicectomies, hernia surgery, cholecystectomies for that matter, resection anastomosis, bowel obstruction. So for these surgeries, there should be adequate exposure, and you should cross the learning curve. So as long as you're crossing the learning curve, it is fine. That institute is okay. So look for the overall exposure, academics, and the bare minimum amount of surgeries which you need to do. The other things you can always cover up when you do a senior residency. Similarly, I think so, as Sir mentioned, that basic trauma work, fracture fixations, amputations, those are the things, if you're getting adequate exposure to, plus other additional new technologies, you should choose those institutes over just an institute where you'll get cutting, but you're not understanding the concepts anymore, concepts there.
Agree,
So
absolutely
would
agree
you
with
agree
you.
with me? The other thing is MS versus DNB, sir. Before I tell about MS versus DNB in surgery, would you like to elaborate about MS versus DNB in
Right.
orthopedics?
So, MS is a 3 year structured course, and DNB is, if you're doing a primary DNB, again, it's the same thing, 3 year structured course, versus if you're doing diploma ortho and secondary DNB, then it is going to be 2 years. I believe it is the same even now, right? I mean, I did my MS like almost more than 10 years back. The, No,
So diploma ortho is different. So DNB is 3 years and D ortho is then 2 years,
that's
and
right.
then
Yeah.
you
So,
have to do a secondary
so
DNB.
either ways, I believe that
Hmm.
eventually it depends upon the training institution. I have a lot of guys who have done DNB. I mean, I would say that I would rate them equivalent if it is done from a good institution. I have a lot of friends who have done DNB orthopedics. It can be either a primary DNB or secondary DNB. Eventually, what you learn in the institution in which you are being trained in, that is important. Once you clear the exam and once you are doing practice and once you specialize, after that, I don't think it makes any difference whether you have done an MS or a DNB. And when we talk about if suppose future job opportunities, again, even locally or overseas, when you're applying for a fellowship, uh, there is not much of a difference in between MS and DNB. Yes, I do agree that when I was in Singapore and then there was this, then the CVs used to come for fellowship, and always used to ask me to compare which CV is better. Then the consultants over there were not aware about DNB as a course, but they were more aware of MS at the course. So they were asking me, what is this DNB course? Diploma, they understand that diploma is slightly inferior to a degree course, but they were not sure about the DNB, and I said that it is an equivalent course. So for me, on the longer run and also on the shorter run, both the courses are similar in my mind.
Right. No, I have seen diploma candidates and secondary DNB candidates in orthopedics at Safdarjung, and there was no discrimination. They used to get equal opportunities, and they were
Exactly.
equally good surgeons. So I also would like to say that the divide between MS and DNB is fast reducing in terms of opportunities, in terms of skills they are acquiring. They are heavily dependent on the institute where you're doing it from. In fact, I personally believe that DNB candidates are better read. Their theory is much stronger. And that has an advantage when you're appearing for super specialty exams. It helps you crack the super specialty exams. And even in places like AIMS, where there is an interview, and where 5 years back, I have seen a lot of discrimination where DNB candidates were not taken up for MCH. Now, even DNB candidates are cracking the AIMS exam and are joining MCH in institutes like AIMS. For more details regarding DNB versus MS, there is a YouTube video where which I've made regarding surgery as a career option, and I've addressed this point in great detail. So you can watch that video as well. Uh, so, sir, one thing which is become the talk of the town amongst medical graduates and graduates who've cleared the NEET PG exam is the toxic working environment in surgical branches at various institutes. So, were things different when you were doing your residency? And any tips to those people who are planning to take up surgery or orthopedics regarding how to tackle the initial 4 or 5 months, which are difficult?
Well, I think yes, it a lot depends upon your immediate senior, frankly. The consultants are least bothered about you, and the consultants for them you are almost non-existent as long as you're a first year PG. The most important thing is having a very cordial relationship with your immediate peers and um, just forget that, frankly, just forget that there are certain personal commitments like going to the home or going to your hostel room and just enjoy that 1 year. Just think about it that you are supposed to be on call for a whole year. It would make things easier for you when you're mentally prepared for it. I mean, this is the only thing that I can say. Having said that, I mean, I personally had a great experience during my first few years. I had a very good relationship with all my seniors in both postgraduates and senior residents. I did not really face any kind of frustration during my first year, even from day one. Yes, first 1 week was really overwhelming for me because of the amount of exposure that I suddenly got as a first year PG. So I was not able to handle it during the first, I would say, first four emergencies in subdivision. But once you got a hang of it, and fortunately, I had a supportive environment, so I could crack it. But I think you would be another good, a better person to answer how to handle stress doing surgery.
So, sir, look, I personally feel that any surgical residency, the first few months are mentally and physically very demanding. First of all, physically, because somebody has been studying for 6 months, 1 year, they're not used to that kind of physical activity. And when you join a surgical branch, you have to be on your toes for at least 12 to 14 hours a day. So that takes a toll on your body, and you need to be ready for that. And it takes some time adjusting to that. The second is the mental part. And as you rightly said, that surgical branches is all about what kind of a rapport you have with your seniors. And for a first year, I think so, that rapport is most important with their immediate seniors and with the senior residents, because they are the ones who are going to really teach them. The consultants will, of course, pay attention to them, but gradually start liking them. It's not from the first day that they'll start trusting them and handling them important decisions. So one needs to understand how to strike a rapport. I mean, there are various ways to build rapport with your seniors. I think so we can have a separate Instagram live regarding that. But that is the key. And the sooner you build that rapport, you would be more comfortable in the surgical branch. Having said that, yes, there are a few places which are toxic, and I'm not denying the things which are being posted on social media these days. Also, I guess there are the students have become more aware about their decisions, and they're fine with taking another drop year and taking up another branch or another institute later on. So that's a personal decision. But in a surgical branch, like me and Dr. Anuj said, give yourself 3 to 6 months before jumping to
Yeah, I
anything
would also
crazy.
just mention that I think since you have
Right?
mentioned that when I was a first year, I mean, I would see that every year there would be one person dropping in orthopedics as well. In the 6 years, I've seen at least one person dropping, and I would always question their decision why they are doing it. If you're not falling in love with your branch, even after 4 to 6 months, I don't think there is a shame. There would be a lot of pressure on you from your peers that are you
True.
crazy? You've got orthopedics, you've got general surgery, people die for it, and you've got it and you're dropping it. Please, there is no shame in leaving it if you're not in love with it and if you're not coping well with it.
Absolutely. That's a very valid point. So there's no shame in dropping the course which you picked up, but give yourself at least four
Yeah,
to 6 months. Don't
right.
take a hasty decision. So somebody has asked, should your choice of institute matter depending on which city do you want to practice in?
It does make a difference. I would partly agree to it. That if you are uh, planning to practice in that particular city and if you do your training or residency from the same institution or from the same city, you would know more people, you would have a better connectivity, and definitely that would help in getting you more referrals from your friends and peers. So in that sense, yes, it makes a difference. But again, I would still not base my decision entirely on that. I would look on which is a better institution for my learning.
Fair enough. So one more question is constantly popping up. Both of us have done our MRCS. I'll share the points regarding surgery and the advantage of doing MRCS. Can you share the points regarding orthopedics? That what are the advantages of doing MRCS? Is it just another degree, or does it add value as well? Does it help you get
Right.
fellowships abroad also?
Okay. So I've done MRCS and I have done FRCS as well. So that's another thing. Uh, Talking about
Correct.
MRCS, I think MRCS at this point of time, the MRCS or in orthopedics, there's no separate exam. It is just a general surgery exam only, in which a part of it is orthopedics. It still holds true, right, Rohan? It is still the same. Orthopedics does.
It's still the
Yeah.
same. It's a common
So
exam for
there
surgery
is
and
only one
orthopedics.
exam.
Correct.
The only advantage that you would get apart from getting another degree is that you would, you do not have to give lab when you're going overseas. With regards to fellowship, there is no advantage. there is some advantage, I believe. I don't know whether it exists now also because the laws keep on changing every month. There was some advantage in going to Middle East. I got an advantage. I could enter into Singapore because of in
That's
Singapore
true
I
there.
could enter because of my MRCS. It was not because of my MS orthopedics or because of my MBBS from Maulana Azhar. So I could enter Singapore and work as a registrar initially was because of my MRCS, but that advantage is stopped. They are not taking registrars who have done MRCS. There's no preference to those people anymore. So yes, that is the only advantage of MRCS. Apart from that, there isn't much in orthopedics.
In
And
orthopedics, sir.
if you really want to specialize something,
Correct.
I would personally, at this point of time, having done MRCS and FRCS both, I would say that if you really want to learn orthopedics, better focus on FRCS, which would still give you a bit more preference when you're applying for fellowship. But it's a more taxing exam.
So can you
Yes.
straight away apply for
So
FRCS
yeah,
without
I
MRCS in
think in
ortho?
surgery as well, FRCS trauma and orthopedics, which is the intercollegiate one, which is being conducted by Joint Surgical College fellowship exam. You can, if you have 4 years of experience, even without MRCS, they allow you to take that exam.
Perfect. So MRCS for surgery, of course, it's an additional degree which you can put in front of your name. If you go into the Middle East, as Dr. Anuj also pointed out, you're given preference, the packages are much higher. And if you have your MRCS, you don't have to go down the PLAB route to register in UK. So you can get a GMC registration straight after MRCS, and that can help you enter into the system where you can choose one of the subspecialties plastics, breast, colorectal, vascular, and then you can gradually build up your career in them. Other than that, in India, if you have MRCS, if you're applying to a corporate institution, they might value that. But in otherwise private practice, it will not have much say. So that was regarding MRCS. Any other questions? We are about to wrap up the session. If you have any questions, we'll be happy to answer them for the next couple of minutes. So 2 questions have come up here. One is color blindness and surgery. And I think so I have addressed this multiple times that if you have color blindness or if you have tremors, you need to ask yourself this question, that will it affect the patient's outcome? Right? It's not whether you can read the Ishara charts or not. You have to answer this question to yourself, that will your handicap affect the patient outcome? And if the answer is yes, it will affect it, then please don't take up a surgical branch. Sir, would you agree with that, or
No,
would you have
definitely,
different
definitely. I
thoughts
think
regarding that?
the most important aspect about color blindness is that whether you can actually perceive different colors. When you're doing a surgery, there is an artery, there's a nerve, there's a vein. There are very subtle color differences. If you can appreciate it, I mean, some people would have an altered color perception, and I know colorblind. Is there any law? There's no law with regard to colorblind people. Yeah.
There's no law. In fact, somebody had asked me what is the UK stance on this. And I read through the MRCS manuals as well, and there's no law regarding this. So it's just a clinical exam which you have to pass. But I tell
Yeah,
everyone that
and
you need to answer this question for yourself.
I know colorblind surgeon in who was my colleague, and he's doing exceptionally well. He's an exceptional surgeon. But the most important thing is that you should be able to appreciate that subtle differences in the color when you're operating upon.
Correct. Somebody is repeatedly asking that in this competitive era for surgery, can you do without doing a super specialization? Can you survive as a general surgeon? I think so. We've had adequate discussion regarding this, and you can go back and watch this video. And I've told you that yes, you can survive as a general surgeon as well, both in a tier 1 city, tier 2, and tier 3 city as well. There is no problem if you're just a general surgeon. But yes, laparoscopy is something which you should know to survive well in surgery. So would you be knowing if somebody is asking MAMC versus KEM ortho, or Delhi orthopedics versus Mumbai orthopedics? That's a very common question which is popping
Yeah,
up.
so
Any views on that?
what KEM definitely at my time it was better. At this point of time, also I believe KEM is better. as long as orthopedics is concerned. But obviously, the reason I was getting SIAM, LTM, so I was getting that. I picked up my MS through All India. I did not picked it through DPG. So my options were LTM, Safdarjung, basically Delhi, and the third one was SMS Jaipur, which I had opted for, which if I didn't get any of them. So the reason for picking up Delhi was very simple, that it's my home. So that is why I did not want to move out of it. But yes, if I was
Fair enough.
not from Delhi, I would have probably thought about LTM as well.
Very interesting questions. Is it good to do a PG from the same institute where you've done your undergraduation? What are your
Doesn't make
views
any
regarding this,
difference,
sir?
I believe. Yeah. If you yeah, you
I
okay.
personally think it's a great advantage. So, I mean, we have seen it in our times. It's a great advantage because you already have a good rapport with your professors. They've seen you during your undergraduation, and that helps the cause. So, in my
Okay.
case, it was a
I
huge
did not do
advantage.
from the same institution.
Sir, would I know, sir? Would you have any idea regarding
It's
DNB,
good.
Ortho, and Gangaram?
It is good.
It's good. So if somebody has to choose DNB ortho from Gangaram or a peripheral place, say they are not getting Delhi, they are not getting Maharashtra, not getting SMS Jaipur, what would
Okay, so
you
I have
tell them?
seen that DNB ortho from Gangaram, or I mean in not in Delhi, I would say Stephens and Indian Spinal Injury Center. I think these three are good institutions, as long as DNB is concerned, apart from the government colleges. So those who have done from there, and finally when they talk about their surgical skills, I think they are equivalent to ours. Uh, so in that sense, but their
Correct.
exposure is quite different. So the problem, what happens sometimes in DNB, so for that, is with regards to passing the exam. So that kind of teaching might not be available, but now you have a lot of platforms and a lot of courses available, especially the PG courses that you can do. You go there and do it. Uh, you can obviously learn your, like academics from there as well. But you get a lot of exposure in,
So the
yeah,
passing rates
passing
have
rate must have improved
improved.
as well.
Somebody's asking about MS Ortho and JIPMER. Would you be having any idea for
P
JIPMER and PGI
PGI orthopedics MS is
orthopedics
good.
there, sir?
PGI definitely is very, yes.
Do they
So
get hands-on? Because
they
in
do not get.
surgery, they don't get any
I was
hands-on.
getting PGI surgery. Do you know that?
Okay.
I
Right.
got PGI surgery during my PGI exam, and I went to the PGI surgery, and they said that actually Nancy surgery is better. That is what they told me straight ahead, the resident over there. Orthopedics, well, yes, I have had interaction with two PGs, two PGs of PGI Chandigarh. One of them had a very great hands-on. He was very confident. The second one, not very much, but I would still say it was comparable to MAMC. Still a decent one. So they get reasonably good hands-on.
Correct. And what
JIPMER,
about
personally, I
JIPMER,
have
sir?
no idea, but I've heard it's good.
Okay. And MAMC ortho versus UCMS
Both are
ortho.
the same. There is not much of a difference. If you are, as someone mentioned, if you are you have done MBBS from UCMS, pick up UC Ortho. If you have done MBBS from MAMC, then pick up MAMC Ortho. Then.
Regarding surgery, please watch my videos on my YouTube channel, Surgery as a Career Option. There are 3 videos in total where I've covered the institutes as well. So for surgery colleges and DNB institutions, please watch those videos. Surgery as a Career Option on my YouTube channel. All these questions would be answered there. Again, regarding tremors and color blindness, please, you have to answer that question, that if you think your tremors or your color blindness would affect patient outcomes, then please don't go for it. But if you think that you can manage with them and they're not going to affect patient outcomes, you can still differentiate the colors, then you please go ahead and you can take up surgery as a career option. DNB general surgery from Gangaram is a very, very good DNB program, and the passing rates are good. The overall exposure and academics are excellent. So yes, if I had to choose it, I will choose it over peripheral places. If you're not getting Delhi, Maharashtra, the good colleges in UP and UP, Rajasthan, Tamil Nadu, then you can go ahead and take up DNB general surgery in at Gangaram. Okay, so thank you very much, Anu sir. Thank you for taking out time
No worries,
from your
Rohan.
busy schedule and discussing this. I'm sure students will message you on your Instagram ID if you have questions regarding orthopedics. Please do follow his Instagram handle, and he will be able to help you out. He is a faculty at various places as well, so he can help you out in choosing between various institutions. So thank you very much. This video will be posted on my Instagram handle, and I'll try to post it on my
Yeah,
YouTube
and
channel as
please,
well. Thank
thanks a
you.
lot,
Good night,
Rohan,
everyone.
for having me on this. I think we had a very fruitful discussion, and I believe that whatever points I've mentioned, it would definitely help the students a lot. And if you have any questions, any burning issues with regards to orthopedics, I will try to answer, though I'm not as updated with regards to postgraduate education, considering I have done my post-graduation more than 10 years back. But whatever is my experience, I'll definitely try to help you out. Okay, thank you very much, Rohan. Good night.
Thank you. Thank you very much.
Bye.
Good night. Good night, everyone. Thank you.